After transferring your data from the data collection tools to the data synthesis and analysis tool, your research team is ready to begin the results analysis and apply the benchmark on worksheets 5 and 6. The purpose of this step is to understand the big picture of how all the schemes are performing individually and at the system level. We recommend that your research team has a facilitated meeting in which a designated person, often the team leader, creates a safe space for all attendees to voice any concerns they may have and allow for debate and consensus building. In the data collection step, your research team collected scheme and system level data for the different schemes on how they impact equity, efficiency, accountability, how services are used, and others. Your research team will step back and analyze this results analysis worksheet across all the schemes to look at the impact or changes to the health system level and answers of the questions. Where has the country made most progress in achieving universal health coverage objectives and goals? How might purchasing be more strategic to accelerate further progress towards universal health coverage? Where are the biggest gaps? Once there is consensus on the system-level results, your team reviews the benchmarks worksheet. SPARC consolidated assessment guides and frameworks from different sources into 11 benchmarks so countries can create a snapshot of their progress towards strategic purchasing. These benchmarks have been applied in 9 African countries and were used to inform policy dialogue to make improvements on health purchasing. The benchmarks are divided into 2 sections. There are 3 benchmarks for progress on governance and institutional arrangements, and 8 benchmarks for progress across the 4 purchasing functions. The colors of the benchmarks are matched to the framework questions shaded in the same color in the governance and purchasing functions worksheets. During the facilitated meeting, your research team will start by reviewing the responses to the framework questions linked to each benchmark. The discussion should encourage different views and debate to reach a consensus on the progress of each health financing scheme towards strategic purchasing. One possible outcome is discovering that you have more questions before consensus can be reached, and more data and analysis is needed, and that is part of the process. After the benchmarks are applied, your team should identify and discuss the purchasing issues affecting the broader health system, and where there are opportunities to borrow lessons and best practices across schemes. For example, you might find that different payment methods are not aligned, or having multiple schemes dilutes the influence that any one of them has on provider performance. When your research team has finished the results analysis and applying the benchmarks, they share the data analysis and synthesis tool with the technical reviewer, who may come back with further clarifications for the team. Eventually, the team reaches a saturation point where no more new information can be collected and uses the available data to draw conclusions and recommendations for improvement. The conclusions from these 2 worksheets will be a key output for policymakers and helps them quickly spot where there is action needed or policy changes that might improve the purchasing functions. The benchmarks can be repeated again in a few years to gauge where there have been improvements or where there has been stagnation or regression. It shouldn't be viewed as a one-off exercise, but rather an opportunity for continuous reflection on where countries can do better and become more strategic health purchasers.